In a world where looks and image are everything, imagine feeling too ugly to even step out the front door. So ugly that you wanted to kill yourself. It might sound ridiculous, but for victims of a little-known mental illness, it's a daily reality. No one knows what causes body dysmorphic disorder, or BDD, but it leaves once healthy teenagers crippled by their imagined ugliness. It's insidious, and it's potentially deadly.
Body dysmorphic disorder is a chronic mental illness where you can't stop thinking about a flaw with your appearance, a flaw that is either minor or imagined. But to you, your appearance is so horrifying that you can't bear to be seen by anyone. Body dysmorphic disorder has sometimes been called imagined ugliness.
I'm really disgusted by how I look. I look at it and just think, you are so revolting.
This is how 15-year-old Kiara Noakes spends most of her day, every day.
One morning, I sort of woke up and went, oh my God, I've looked like this for my whole life.
What did you see?
I just see it's horrible. I just see it's so ugly.
When you have body dysmorphic disorder, you intensely obsess over your appearance and body image, often for many hours a day. You may seek out numerous cosmetic procedures to try to fix your perceived flaws, but never will be satisfied. Sydney is a 30-year-old woman. She feels that many of her body parts, such as her breasts and eyes, are different sizes. She cannot help but think about her flaws, her imagined bulging stomach and scarred face 30 times a day. She washes her face and obsesses about her appearance nearly all day, and she is never content.
On a scale of 1 to 10, where 1's the worst, how ugly would you rate yourself?
I was definitely 1. The ugliest.
She became fixated by barely visible stretch marks on her thighs. She was convinced they were spreading over her body.
Behavioral cognitive therapy. Exposure and response prevention is a type of cognitive restructuring where clients learn to challenge the validity of their distorted body-related thoughts through imaginal exposure, using short stories based on their BDD obsessions. This method has been proved to greatly reduce the frequency and magnitude of intrusive BDD obsessions, as well as the individual's sensitivity to the thoughts and mental images they experience. Mindfulness-based cognitive behavioral therapy. The ultimate goal of mindfulness is to develop the ability to more willingly experience their uncomfortable thoughts, feelings, sensations, and urges without responding with compulsions, avoidance behaviors, reassurance seeking, or mental rituals. Behavioral therapy aims to change the neurobiological/neurochemical pathways by changing behavior, and the brain will follow. Behavioral therapy focuses on teaching you healthy behaviors such as being social and avoiding obsessive behaviors such as mirror checking. Psychotherapy is helpful for those with milder, non-delusional symptoms. Above all, the goal is to help the BDD sufferer turn away from a preoccupation with appearance and engage in treatment for underlying problems. Biological therapy. Psychiatric medications used to treat depression can be prescribed for body dysmorphic disorder. The medications prescribed most commonly are selective serotonin reuptake inhibitors. BDD requires higher doses of those medications than does depression. Cosmetic surgery is often used for BDD patients, although no matter how many procedures are done, they will never be satisfied. Group therapy. Research has shown that group therapy is extremely effective in the treatment of body dysmorphic disorder. Knowing that there are people who feel the same way and who can help each other has proven to be an effective way to treat the disorder. Although group therapy is not effective on its own, it must be accompanied by cognitive therapy or some form of medication in order to be effective. BDD increases the risk for suicide. Half of those with the disorder develop alcohol or drug problems. Similar numbers of men and women have BDD, despite the stereotype that women are more concerned with their appearance.
No matter how often BDD sufferers are told these so-called hideous flaws are in their imagination, their reflection tells them otherwise. But why do they see something no one else can? Well, the short answer is we don't know. Doctors are at a loss to explain what triggers BDD. It seems to strike randomly, a tragic luck of the draw that affects women and men equally.